Thank you to all the panelists. I didn't have an opportunity to say this earlier, but I do want to express profound gratitude to all of the incredibly brave, compassionate, and dedicated individuals who are providing care in our nursing homes and our personal care facilities. They really are incredible people. Dr. Levine mentioned ECRI in her last response to the gentleman from Lancaster County. And not been able to find a lot of information out about the contracts that have been entered into by the administration recently, whether it's with CMU or with ECRI. But my understanding is that ECRI is an independent nonprofit organization that their goal, their mission is improving safety, quality, and cost effectiveness of care in healthcare settings. And I'm wondering if you could speak a little bit about ECRI, this new consulting company that the Department of Health has partnered with. You know, how did you find out about them? What type of value or service are they providing to nursing homes, personal care homes that the Department of Health hasn't previously provided? And how has that been working so far, particularly during this pandemic?
Okay, I'll start here. You know, as I detailed in my testimony, long-term care providers, be it nursing homes, personal care homes, or our assisted living communities, have really been asking for help since this epidemic began. And, you know, a few weeks ago, the Department of Health told us that that help was on the way, and it was coming in the form of ECRI, which, as you said, is a virtual consulting firm from Montgomery County. So ECRI has been tasked with visiting providers virtually and helping with infection control measures as well as outbreaks. Now, the latest numbers that we've been given show that ECRI has visited 70 facilities statewide. And while that may sound like a good footprint, remember, there are nearly 2,000 long-term care facilities across the state. So if we use that number, ECRI has visited 3% of all statewide facilities. Now, I said earlier in my testimony, there are nearly 500 facilities statewide with a positive case. Using those numbers, ECRI has visited 14% of those facilities. If this is the department's answer to the challenges facing long-term care, and if this is the hand that they're extending to aid providers during this time of crisis, that is an inadequate response. Providers should have been consulted. Senator Martin asked a question earlier, were we engaged on guidance? Were we engaged in these efforts? Providers were not. They should have been asked, what do you need? Because I can tell you, after speaking with my membership over the last few days, this certainly has not been it. Thank you.
Thank you, Mr. Schamberg. I'm very concerned. I hear you. None of the members who are here today present want you to be ignored. We want you to have the resources that you need, and I find it very troubling and disconcerting that we're investing in resources that aren't producing the results that we need. So I thank you very much. Madam Chair, thank you.